The Achilles tendon is the largest tendon in our body. It connects the calf muscles, known as the gastrocnemius and soleus, to the heel bone, also known as the calcaneus. It is essential for gait functions as we know it, walking, running, jogging, jumping, and very important for push-off. Achilles tendon injuries can range from acute tendonitis to chronic tendinosis to ultimately a rupture of the tendon. Acute injuries happen when it is tweaked, and so you can get an acute episode of pain, whereas when you get chronic degenerative changes, you can notice some thickening of the tendon if you have non-insertional tendinosis, or even a prominent bone spur at your heel if you have insertional Achilles tendinosis. Or if you have an acute injury while playing sports, especially with the rise of pickleball, you can get an acute rupture. With an acute rupture, you'll likely have swelling of the leg, some pain, and notice a difference in your gait. Risk factors for Achilles tendon injuries are varied. Age is a big one. Acute ruptures and degenerative changes are typically seen in your either middle-aged or elderly patients. Acute ruptures tend to be seen in the weekend warriors, so those individuals who are just going out and doing exercises on the weekend and not necessarily doing the best warm-up. You don't necessarily have to have prodromal pain for an acute rupture, but it can happen. Also, individuals who have taken fluoroquinolone antibiotics or anyone who's had a steroid injection anywhere near their tendon are at risk for rupture. In terms of diagnosis and treatment for Achilles tendon injuries, there are sort of two different camps. For degenerative changes where you have either non-insertional or insertional Achilles tendinosis, then you can notice some thickening of your tendon or a prominent spur at the back of your heel. Patients often have some pain with activities. That can be diagnosed in clinic on physical exam and with radiographs. Sometimes an MRI is needed to look at the health of the tendon. The mainstay of treatment for these tends to be conservative, trying anti-inflammatory medications, ice massage, and eccentric strengthening with either physical therapy or a home exercise program. If that doesn't work, there are some more invasive alternatives that can be tried. For non-insertional Achilles tendinosis, shockwave therapy is quite effective, or you can try doing PRP. However, it is very important to remember, never let anyone inject steroid anywhere near your Achilles tendon, because that puts you at risk for rupture. Achilles tendon ruptures can also be diagnosed on physical exam. Sometimes you will need some imaging, but always at least get one x-ray to make sure that there is no fracture associated with the rupture, but an MRI is not always needed. You can tell by key physical exam findings if you are prone to looking at them. However, if somebody is not used to diagnosing an Achilles tendon rupture, it can be missed up to 25% of the time. So if you've had an injury where you felt a pop or felt like somebody stepped on the back of your leg, it is important that you come and get checked out so you can be treated right away. For treatment, these can be treated non-operatively if they are caught immediately after the injury. However, even after 3 days, if the ankle is not placed in a plantar flex position, then there is risk that the tendon will heal in an elongated position and you can have chronic weakness. If it has been longer than 3 days and you have been pretty flat, then surgery is usually recommended so that you can get the appropriate tension on the tendon. If it's been a very long time, surgery can also be done. However, a direct side-to-side repair might not be possible, but then you would be looking at augmenting the fixation with either a tendon advancement, tendon transfer, or even an allograft reconstruction. To prevent injuring your Achilles tendon, number one is never let anyone inject steroid anywhere near your tendon, as that increases your risk of rupture. If you are concerned, I would definitely seek treatment to be evaluated. Also, always make sure that you stretch before any physical activity. Try not to get your calf very tight, and that you're wearing good supportive shoes. If you are new to exercising or starting a new regimen, go slow and listen to your body. If it hurts, seek treatment. The Achilles tendon is a miraculous part of our body, essential for gait as we know it. However, a lot of different things can go wrong, from an acute injury to a rupture to even degenerative changes. If you're having pain in the back of your calf or near your heel, seek treatment so we can help address it.